Good afternoon, everyone. My name is Aaron Wicks. I'm the Vice President of Organizational Capacity Building here at the Community Action Partnership, and I'm joined by my colleague at NASCSP, Mary Beth Schneber-Remrev. Mary Beth, you want to say hi?
Hey, hi, Mary Beth Schneber-Remrev. You did a great job, Aaron, with my last name. I'm the CSPG Assistance Director with NASCSP. Really happy to be with you this afternoon.
And we're happy to have the opportunity to have a sort of a joint presentation and initial feedback session about the state TNTA plan template that will be coming out. And so that's really the purpose of our presentation today, is to set the stage for what is going to be coming in just a few weeks. So for those of you who are new, we'll be answering the question, what is the state TNTA plan? But for those of you who are familiar, we may be answering the question, why? Because it's been a while since we've talked about state TNTA plans. Fiscal year 20 turned out to be kind of a gap year, more so than I think any of us anticipated with what's currently going on across the country. So the state TNTA plan sort of process has been paused for a few months, and we're going to begin getting it back on track. So we're going to start by talking about why we do this in the first place, just to make sure we have a common grounding in that. We'll then review the template that we've used in the past. Excuse me. We've made some updates because of HCCT and because of COVID. So we'll talk a little bit about some of the changes and ask for your feedback on sort of that content. Obviously, once we have a draft ready for sharing, we'll share that, and you can provide more concrete feedback on the document itself. That'll be forthcoming quite soon. We'll review the TNTA categories that we have that help structure how we develop common plans, because the goal, or one of the goals of the state TNTA plan process, is to have some commonalities across states and regions in terms of how we identify and plan training and technical assistance, so that we can coordinate it a little bit more effectively. So we have kind of some buckets of TNTA categories that we'll share with you. And we'll talk a little bit about the timeline and when these plans are going to need to be developed and submitted. And then we'll invite a little feedback on anything we've covered today, the content of the TNTA plans, maybe some things that should be there that aren't, the timeline, which I know we're all concerned about because of all of the work that we currently have on our plates, and that we know will be forthcoming with the final half of the current fiscal year, the new supplemental funding coming. It's going to be a busy summer for community action, so we want to be sure you have plenty of time to plan out your work and make sure that this TNTA plan can fit into that in a reasonable way. And then we'll also invite your feedback on the categories of TNTA. So we want to start today with why, because it's already come up in a few venues. Why do we do this? Let's just provide our TNTA. We have a state CSPG plan that has TNTA sections in it. It seems like we're duplicating efforts. Why are we doing this? Well, we have an answer to that. The TNTA plan template is nothing new. It's been in use for several years as part of the previous Organizational Standards Center of Excellence and the RPIC grants that have been in effect for several years. The main purpose of the TNTA plan, though, and this is really sort of the bottom line of our discussion today, is to promote encourage, support, collaboration, coordination, um, and communication between state associations, state offices, and the local community action agencies within a state. Now, for those states in which that collaboration is already strong, you're already working closely together, then the state TNTA plan should be a very easy process. It should just emerge out of your existing conversations. But for those states where the communication isn't always there, or the collaboration isn't as well established, um, this process is meant to make sure that any discrepancies between what the state offices are seeing as TNTA needs and the state associations see, those discrepancies can be raised and discussed and kind of addressed in a collaborative manner. So Mary Beth, I'd like to invite you to speak a little bit about um, your perspective as to why this process is so important.
Yeah, thanks, Aaron. One of the things that I think about with any plan is that sometimes the value of the plan is actually the process itself versus just the end product. And especially in moments like these guys, where we're running from thing to thing because we have to, sometimes there's value in just taking a step back and thinking critically and creating space to think critically about the needs and what we'll do about those needs as supporters of this critical work, right? And in order for us to really support this critical work at the local level, I think we need to get a holistic picture, right? Agencies are not just subgrantees, and agencies are also not just members, right? They are both of those things and more. So I care team in some ways that everyone has their perspective, everyone has their specialty, and we need to plan to provide to those front lines together, coordinated holistically. And at this time, it is just more critical than ever. Each player has their unique lens that they see the agencies, and we can coordinate to serve the network by working together and coordinate the most effectively to serve the network most effectively.
All right, thanks, Mary Beth. And just to sort of add another um, idea to the mix, you can think of the state TNTA plan as kind of a community action plan for TNTA. Just as our community action plan has to be based on a needs assessment, and the needs assessment has to include all of the community stakeholders, the state TNTA plan is meant to be that for TNTA activities within a state. So you need all those key stakeholders. You need the local agencies, you need the state associations, you need the state offices. And they all bring different perspectives to that discussion. So I think it's a process that we're familiar with in terms of the community action plan. This is just another dimension of it. And I just want to also add what we're hoping to do um, as we go forward is use the data from these TNTA plans to promote broader collaboration. So the RPICs have already been a key part of the process in terms of helping to facilitate um, the development of the plans and working to coordinate regional training resources. That's been going on for some time. We want to continue to build that network infrastructure. And the best way that we think there is to do it is to have a common TNTA planning approach, so that we can all sort of share information about where the needs are and where we need to develop resources. And so that's kind of where the partnership comes in terms of the HCCT Center of Excellence project. One of the roles there, at least in terms of supporting some of the capacity building of agencies and the national network, um, is to aggregate that information from across the different states so that we can really focus on the needs of the network and where the TNTA needs are most significant. So a little bit in terms of process, and we've kind of addressed this generally, but Mary Beth and I want to just go maybe a step deeper. The idea is that the the process would involve state associations and state offices working together to sort of compare notes. The state office might be looking at some of the monitoring information that they've collected from across the network in the past year, where they've identified areas that they feel there needs to be more technical assistance provided to support agencies. Um, but state associations get a perspective as well from the local agencies in terms of things that they're trying to do, things that they're trying to strengthen or grow um, to be more effective within their service area. So it would be wonderful if those two different views just naturally aligned, and sometimes they do, but often they don't, just because the stakeholders have different perspectives. And so a key part of this process is that there's early and frequent collaboration between particularly the state association and the state office. And I want to emphasize in terms of process, and Mary Beth said this as well. The key here is the discussion and the development. The key is not to develop a plan and check a box and then say, okay, there it is. There's the state TNTA plan. Now leave us alone. Um, if that is the approach to the process, then the process won't be a useful process. Um, the key is to use that process to promote the conversation. And hopefully a common process across all the states will allow us to have data that we can aggregate both regionally and nationally so we can better target resources. Mary Beth, what have your observations been about that process?
Yeah, so I think that one of the things I've heard from state offices is, well, we already have a state plan where we delineate TNTA needs. And from state associations, I've heard, well, we have our contract with the state office that delineates those TNTAs that we'll offer. I guess what I would say is that this process, if done at the right time and in the right way, can actually help inform those state plans where you input your TNTA. It may also help state offices to inform those contracts that you have with your associations to assure that you're funding your association to do the work that is most critical right now to your network. And I think that conversation at this moment is, again, I'm probably going to say this 6 times while we're on the call, it's even more important than ever, because the needs that we had 6 months ago, those needs may have changed drastically in the last 6 months just because our world has changed in the last 6 months. So we have got to have this conversation, and we should use this conversation then to inform those other plans that we develop. I do also want to say I've seen a number of regions then who can in turn take this aggregated data that's collected the same way and use it to inform a regional approach, right, which was some of the point of our pick, right, regional performance. But we've seen some of this. For instance, I know Region 8 has an upcoming conference that they're going to do, right? Part of the reason that they're able to do some of that is by having these conversations about those needs regionally and identifying those big TNTA needs that aren't just in your state, but across the region. And that enables you as well to pool your resources to, again, better meet those needs. And then, Aaron, just to your point, this really helps us at the national level. What is top of mind? There are things that we can see pretty clearly, but sometimes you all might identify something that is just emerging that hasn't quite bubbled up to the national level, and this is one of the ways to get it on our radar and ensure that we're best meeting your all's needs as well.
And thanks, Mary Beth. And I want to emphasize one of the points that Mary Beth made. They were all important, but one in particular I want to highlight in terms of the timing. We're in a very different era than we were just a few weeks ago. So this is really an ideal time to take a step back. The dust hasn't even settled yet. I mean, we're still scrambling as a network to meet the very urgent needs that are out there. But this process, this developing these updated plans, this process, we have about 3 months to go through this process. We're looking to have these developed by the end of August. So this is a good time if you haven't already had a lot of close communication about, where is our state going, where are our agencies going in terms of their ability to provide effective services and to provide community change activities. This is a really good time to start taking a step back from all the activity and thinking a little bit longer term. Because if our network doesn't do that, we're going to get left behind, and the world is changing very quickly. So we need to be sure that we have the fundamentals in place in terms of all of our community action agencies, financial management, human resources management, outcomes management, et cetera, to be able to continue to be as nimble and responsive as we've been during the current crisis. So I want to turn it over to my colleague at the partnership, Courtney Kohler, talk a little bit about the value of these TNTA plans. Courtney has been involved in the development of these plans and has analyzed the data from them for several years now. And she's got some learnings to share about what feedback we've gotten from the network about how these plans have been useful. Courtney?
Sure, thanks, Aaron. So, this is some of the stuff that we've heard from you all as state associations and state CSBG offices of the value of the state TNTA plans and some of this, this process. And so some of what we've heard, these top 3 points here, was some of the feedback that was shared through one of these RPIC surveys that we did. We actually asked both state CSBG offices as well as state associations, kind of more to the ask of what has been the value of the RPIC. But what came out of that was partially speaking to the state TNTA plan, the enhanced collaboration between the state CSBG office and state association. Many cited the state TNTA plan as one of the key pieces that helped enhance some of this collaboration. Also that more efficient coordination of training and resources within states as well as across regions. So focusing on, what are states doing intentionally through their collaboration, as well as then how are we able to pool resources at the regional level and work together on those TNTA strategies that are similar across states within that region. And then just overall that more strategic approach to training activities, which I think speaks to the state TNTA plan as well. And you see a few others listed here, but basically, those top 3 really kind of link into that state TNTA plan and speak, I think, to some of that value. You go to the next slide, please. So this is just showing some of the state TNTA plan data. So it's directly the information that you all are putting into the SurveyMonkey piece of the state TNTA plan. And so this was from fiscal year 2019. And what we're able to do, like Mary Beth and Aaron was saying, was that we're able to aggregate some of these training needs at the national level. And so we're able to better target our efforts as far as what topics we target our training and technical assistance towards to make sure it's most relevant to you all. So that's just showing you that we're able to do that part. And then on the next slide, we can break it down even further in looking at different providers, service delivery or training delivery strategies, and being able to look at different categories of training and technical assistance so that we can, dig deeper into those different categories. So we're not necessarily just looking at board governance, but we're able to, or financial operations, but we're able to look at what about that do we need to make sure we're targeting our trainings at, what different delivery methods are state associations, state CSPG offices using, so that we can better, target what is most effective and what people are doing, what we can do to help out as well. So that's just some of the data that we're able to collect and learn from. Also, we share that back out with you once these reports are developed so that you all can kind of see that information that's come together. And so that's just a little bit of what we're able to do with this information that's provided that is submitted through the state TNTA plans.
Okay, thank you.
Great.
Thanks, Courtney. I'm sorry, I was a slide behind, but just wanted to show you that that the data that we get from the TNTA plans is pretty rich in terms of giving us a snapshot of what is anticipated across the network. So this will be particularly helpful as we get to the end of this fiscal year. It'll be very helpful going into fiscal year 2021. Because for those of you that have a particular focus on HCCT, because of your role with the RPIC perhaps, year 2 is the year that regional convenings need to happen, in which highlighted HCCT initiatives will be shared, and some training and technical assistance will also occur. So the planning that will go into those regional gatherings is certainly something that's going to be starting over the next few weeks and months. Mary Beth, I'd like you to walk through sort of the sections of the TNTA template that we currently have in draft form, and we'll be getting this out to everyone fairly soon so that you can give us some more concrete feedback, but this just sort of refamiliarize you with the elements of the template and what information we'll be asking for.
Yeah, I think that the TNTA plan, what you'll find is it looks fairly similar to what you did back in October. That feels like a lifetime ago. We have revised it a little bit. We have heard the feedback about streamlining things, and we're really taking that to heart, making the questions clearer and a little bit better connected. So we'll start with the TNTA needs. Essentially, this is your needs assessment process like Erin was referring to. You'll just describe how you assess the needs. You don't need to be super this is, a few paragraphs just to kind of give us the rundown. And then just like we ask agencies to do with their with identifying their top needs is to then prioritize them, right? Some needs are more critical than others at any given time. So we'll ask you to prioritize your needs and your top 10, and then we'll ask you a little bit about TNTA specific to the HCCT initiatives and COVID and transformation in a larger sense, right? We'll ask you to talk about those high priority TNTA needs for supporting these transformative practices that the network has been engaged in already and will be engaged in the next year. We'll also want to get some information about how the RPIC and the state agency collaborated with each other during year 1 of this initiative, and then how you're going to keep that going, right? How are you going to keep that train going, keep your momentum going, and bring it forward? How will you continue to do that? And how will you all continue to work together to address the transformational needs of the network? So then we come out of the needs part of the ROMA cycle, and then we come into the planning component. We'll we'll ask you to review the strategies that you'll employ to meet those needs. And I just want to point out here that just like in Roma, you should consider what other resources exist. So pull out those calendars from your peers, from the national organizations, and kind of figure out if there are some existing resources that might help you to meet some of those needs, and go ahead and list those out in your strategies. And I just want to point out too that in this world at the moment, that strategy planning may be even more critical, as so many things are now available virtually. There's in some ways some increase in access to TNTA. We might be able to get deeper into organizations because we know not everybody can perhaps travel to some of the big national events, or vice versa. But alternatively, though, it may take more time for you to build out strategies for a virtual environment. There are some nuances about setting up a virtual conference or a virtual TNTA that you might need to think through, and that you yourselves might need to get some training on in order to be able to effectively deliver. So then we come to everybody's favorite portion, which is the TNTA topics and activities that you complete in SurveyMonkey. And I think we've said this a couple of times now, but we heard you, and we'll take a look at how to streamline that and make it a little bit more user-friendly. We know it was a little bit lengthy last time, and you should look for that to look a little bit more straightforward for this go-around. And then finally, you come to your implementation plan. How will you implement this? How will you continue to communicate and coordinate with one another? And then, just like in Roma, how will you evaluate this plan? How will you circle back and ensure that you were effective in your plan? And you know, did you meet the needs that you first identified? Erin, anything you want to throw in on that?
No, I just want to remind everyone that what Mary Beth walked through is really very similar to the format that's been used in the past. And we'll be getting this document out to you soon. So if you are kind of wondering, like, well, yeah, but what are the specifics? I mean, I get the big picture here. What Mary Beth just walked through really is what the specifics are. I mean, the questions, the items that she walked through, those are what are in the template. But we'll be getting a draft of that to you soon, so that you can provide some more concrete feedback to us. Now, I want to shift gears slightly and address some questions that have come up, because I think they're relevant to this slide, which is sort of the how is all this relevant to where we are right now slide. And as is typical for me, any questions that I don't feel I'm qualified to answer, I'm going to go ahead and try to answer anyway. No, I'm kidding. I won't speak for any other organization, but I can give you a sense of what the conversations that I've been involved in are like, and I'm specifically talking about OCS. There was a question about whether RPICs and state associations can shift FY20 TNTA priorities that were in non-compete continuation applications to shift gears to address the new emerging needs. Obviously, I can't speak to what position OCS is going to take on that, but I will say this, and I think this is helpful. I hope it's helpful. The national partners and OCS have been in constant conversation, and we are very much on the same page in recognizing that that the world has changed significantly, and we all want to support the work that needs to be done urgently and not complicate it through unnecessary process. So that's why the FY20 sorry, I'm having a bit of a cat fight, literally. That's why the FY20 state TNTA plans kind of disappeared. We recognized that at this point in the game, um, it, it's really not the best use of anyone's time to revisit those. We're halfway through the year, and things have changed. So I can't speak to what's in your state community action plan, your state CSBG plan, your RPIC plan in terms of OCS, but I can say this: the understanding that all of us have across the network is that the TNTA needs of the network changed dramatically when 2020 came around. So what we're looking to do as we look prospectively into 2021 is try to capture some of those ongoing capacity needs that have always existed. We're always going to need to continue to strengthen our fiscal infrastructure. We're always going to need to talk about um, leadership, organizational leadership, board governance, and board engagement. There are some areas that are just sort of the cost of doing business, and they're always going to be TNTA needs, and we need to keep them um, on the front burner. But we also know that a lot of new needs have emerged. And something that comes to mind, obviously, is the use of technology, staff working remotely, customers being served remotely. That change has necessitated a variety of new TNTA needs. So looking forward, as we look at 2021, what we're hoping that we can do, and we'll welcome your feedback on this, is as you complete the state TNTA plan, we want you to try to tease out what sorts of TNTA needs are higher priority needs because of the COVID-19 pandemic, just so we can get a better understanding across all the states and regions as to what new needs or what existing needs have become heightened as a result of this pandemic, and how much variety there is across the country. So we are asking you, when you identify your top 10 needs, and it doesn't have to be 10, it might be 5 or 6, but when you identify the top TNTA needs for your state, we're going to ask you to just kind of flag the ones that that you specifically see as being important related to COVID-19. It could be all of them, but there might be some brand new ones that wouldn't have otherwise been on your list that are because of the COVID-19 pandemic. And so we'd like to be able to identify those. And then in parallel, we also want to be able to identify where the network is going to need to build some capacity in order to do some of the transformational work that we're looking to do through HCCT. Now, COVID has really scrambled the deck and has meant that we've shifted our focus from, to some degree, from some of that long-term systems change work that we want to do through HCCT, or wanted to build on, since a lot of us are already doing it. And we've had to shift to more of a responsive mode to deal with the COVID crisis. We don't want to lose sight of the need to always be focusing on community transformation. So there may be some overlap. There may be something going on in the COVID response that is also a transformational activity. So as you think through these updated TNTA plans, and particularly as you think through what the future might look like, fiscal year 2021, we want you to think of HCCT in kind of a new light, recognizing that community transformation, family transformation can now take on even more meaning than it did previously, because some of the transformative work that community action is doing right now is in response to COVID. And so some of the capacity building that we need to do more of that work, to keep that work going and sustain it, we want to include that in our TNTA plans as well. Now, there's another question about whether OCS will extend the timeline for HCCT Year 2 deliverables. I don't have any information on that. I can tell you that my position on that is that HCCT has always been meant to lift up the good things the network is doing. And so even though we've been hit with a shock this year, it doesn't change the fact that we're doing amazing things that are transforming communities and lives. So that may not necessarily lead to delays in some of the key deliverables, but obviously it will affect others. So I think that's a conversation that needs to be ongoing. And I can give you my commitment, representing the partnership and Center of Excellence, that that we will be continuing that conversation with the network, with the partners, with OCS, to make sure we can focus our attention where it needs to be, and develop quality deliverables for this initiative. And there's another question about the August deadline. Let me get to that in just a bit, because we're going to talk about timing a little bit later. But I also saw that there's a question about basic process, and I'll invite Courtney and Mary Beth to also address this. It's really up to the state stakeholders in terms of the process that you want to follow to develop the plan. That's a collaborative process. It could take any number of forms. But once the plan has been developed, the plan should be submitted through your RPIC, so that the RPIC can have an opportunity to review the plan with the state stakeholders, and then compile those and then share with the national partners, because that will facilitate the information sharing at the regional level as well as at the national level. So I just want to kind of fill in a little gap there in terms of process. Courtney, I'd like you to just speak a little bit to the TNTA categories, so that when we talk about developing the state TNTA plans, we can have an idea of what some of the different buckets of TNTA look like.
Sure. And this might help answer some of the questions in the chat as well about hopefully having this in time to allow for your state needs assessment on training and technical assistance to kind of reflect this information. Like Erin said, we're striving to get this out as soon as possible so that it can be used in that way, so that you're able to collect information on these different training and technical assistance topics, to be able to gather information on how the needs may align with these different categories. So this is, a lot of this is fairly similar to what you've seen in the past. You just haven't seen it in this format. We have made some adjustments, and we've added some additional training and technical assistance topics under each category, because we, whenever we collect this data, we do receive quite a plethora of information across different types of training and technical assistance within these categories. So you'll see here, I mean, it's the same categories that we've used before with community needs assessment, board governance, community engagement. A lot of these do align with the organizational standards. And so, you'll see some of the different pieces that we've heard in the past. So trying to include those, also trying to anticipate needs looking forward. And then we've also made some adjustments to try to align with the state plan, but also stay true to what the information we do receive in how it's organized. And then on this last page, you'll see some of the new categories. So the human capacity and community transformation, kind of making sure that we're capturing, although HCCT, these different topics do span across a lot of our different categories, we also want to make sure that we are specifically looking at topics that plug into HCCT. And then also, as we're looking at COVID-19 and the training response you might have due to that, we have a category focused on the disaster and crisis response and relief. Knowing that COVID-19 might not be the only type of crisis that you might respond to with training and technical assistance also. So these are just some of the, of course, this is in draft form, but these would be provided with the template whenever it's released. And then this is the part that goes into the SurveyMonkey that you respond to about the planned activities that you're doing within your state as well.
Thank you, Courtney. And let me just emphasize that our goal in providing these categories and these lists of different topics is not to be prescriptive. This is not the TNTA that the partnership or NASCSP are saying that should be provided. Obviously, there are more topics here than any provider could train on in the course of a year. Our goal here was to try to span the most common topics and subtopics, so that we could have a comprehensive menu of possibilities, and there will be the possibility of editing these topics if you have some feedback, or when you develop your plan, if there's a topic that's not here that is an important TNTA need, you can certainly include that. This is not meant to be a restrictive list, but by using some common categories, we're hoping that we can streamline the collection of TNTA needs data across the network. So let's talk a little bit about timeline. There was a question in the chat about August, so let me address that directly. Our understanding, and this is from recent conversation with the Office of Community Services, is that they are anticipating an August deadline for submission. My assumption, because this is just a very recent conversation, and so we haven't fleshed out the details of the timeline yet, but I think it's a safe assumption to assume that the August submission would be submission from the RPICS to OCS, which would mean that to do your TNTA needs assessment, to have your discussions, to develop your plan, that will obviously have to happen sooner rather than later. So you don't want to delay those conversations, but we also recognize that certainly during the month of May, Community Action Month is full of activities, but the supplemental funding is also going to hit any day now. So May may be a tough month to have some of these conversations, but it would be a great idea to get meetings on the calendar for June, so that maybe once the dust has cleared from some of the busy work of this month, you'll still have time to do some of those collaborative focus groups, discussions, other activities, so that you can work together, state association, state CSBG office, to develop the joint plan that would then be submitted to OCS at the end of August. And again, want to emphasize that these plans are prospective. So you'll be developing plans for TNTA that you anticipate being delivered in fiscal year 2021. prospective plans are always going to change. These are not set in stone. They're not contracts. They are plans. They are prospective. So really, we just need your best view um, of what you think your capacities are as TNTA providers, as well as your needs, and then how we can move forward as a network to address those. Mary Beth, what do you want to add in terms of timeline and making sure that we can stay on track with these?
Yeah, just that I mean, be cognizant of the fact that you need to have a little bit of lead time built in. Don't expect that you're going to turn in your state TNTA plans to your RPIC lead August 31st, right? We know that RPICs need to build in a little bit of time so that they can compile and then send them on. Aaron, I do think that there's a few questions in the chat that I'd like to address really quickly. And I think that this slide helped a lot for some folks who maybe aren't as familiar with the process. But essentially, the state associations will be the ones who work collaboratively with, with their state office, right, to develop the plan. Well, I mean, it's a collaborative plan, but then the state associations submit it to the RPIC lead, I think is what I'm trying to say. And then the RPIC lead is the one who then submits it on. There's a question, and it's a nuance I think that's worth exploring, Aaron, about whether or not plans are accepted or approved. I believe I understand that they're accepted. There's not an approval process. Do I have that right?
That's correct. Yeah, yeah. The plan, the development of the plans it's a planning process and a data collection process. It is not a contracting process. So it's not it's not an agreement to commit to something in the future that needs to be approved.
Okay, perfect. Yeah, and I think that's really all that I have to add. I think you've covered it.
Okay. There have been some questions about when things will be forthcoming, and I certainly appreciate those, and they're fair questions to ask. In terms of the template document, I think you can expect to see a draft of that, as well as the training categories that we looked at very quickly, the buckets, as I called them. I think within the next 2 weeks, we'll be getting those out. We've been looking at them between NASCSP and the partnership. We're just going to do a little more review. Certainly, if there's some feedback from today's webinar, just thoughts that have come up that you want to say, hey, I don't know if this is in there, but you should make sure you do this, or I have a concern about this. We want to be able to try to address those before we get something out. But those will be out within the next 2 weeks so that you can see what the template is looking like. And barring any major changes, which I don't expect there would be, you can even begin to use those that draft template at least as some guidance to start your TNTA plan development process. In terms of the SurveyMonkey, we may need to take just a little bit more time to make some adjustments to that, just because the mechanics of it in the past were not ideal. And so I think we just want to have a little more time to get our heads together. If there's anyone from the network, from state office, state association, local agency, that has some particularly strong feelings about what the SurveyMonkey could look like, how it could be more user-friendly, we'd certainly welcome your participation, your voice on that. And as soon as we have the updated SurveyMonkey, we'll get that out as well. Ideally, it'll come out at the same time as the other items. But certainly, as soon as we have a PDF of the SurveyMonkey, we can get that to you. And I think in the
Hey, Aaron, I'm so sorry. There's a question from a state office about who in the state office will receive the template. And guys, I'll be sending that out to our primary contact with the state office. So whoever our primary contact is, that's who I'll send it to. If there's another contact that more is more appropriate, please go ahead and let me know, and I'll update my listing. Sorry, Erin, didn't mean to interrupt.
Yeah, no, thank you. And we'll do the same on the partnership side in terms of state associations and our pick leads. We'll be sending to all of you. So it's more likely that you'll get multiple copies rather than not. But if you do not hear from either NASCSP or the partnership by, let's say today's the 5th, I would say by Monday the 18th, then please do follow up with us, because we should be getting these materials to you by then. So if you haven't received anything by Monday the 18th, it may be due to just sort of an error in mailing lists or something, and so we want to be sure we can rectify that as soon as possible. I did see a question about when is the supplemental money coming, and let me tell you, if I had the answer to that question, I would have put some money on the virtual Kentucky Derby that happened a couple days ago. We're all waiting on that, and the only thing I can say is hopefully it'll be soon. Let me sort of move towards concluding, and I'll just sort of keep an eye out for other questions that have come in. I want to make sure we try to address all of those that have come in through the chat. But I just want to flag for everyone a couple of dates coming up. We're going to do a couple more HCCT themed webinars in May and June. Same time, same day of the week, Tuesday at 3 p.m. May 26th and June 16th. We've kind of worked with OCS to hold those dates. Those may be sort of partnership-led webinars about HCCT. I think we may be talking about highlighted initiative criteria. We may be coming back to the TTA plans later in the month when we have more detail about what those look like, so that we can maybe get into the specifics. Or there may be a topic that OCS wants to cover, but we want to hold those dates of May 26th and June 16th on your calendar, so that we can do some checking in on some emerging HCCT planning news. Because the HCCT Steering Committee and the CSPG Working Group have both resumed their work. So we may have some updates from them as well. And I know that over at NASCSP, the Data Task Force is also going to be reconvening soon. So there's always stuff to talk about. And to the extent that it affects HCCT, we've got time on our calendars. And I saw a comment about the need for comprehensive HCCT training. I agree, and what we'll be doing at the Center of Excellence on an ongoing basis, and welcome your suggestions on this, is developing some materials to help continue to support understanding about what HCCT is and how we can move this initiative forward. And I can share with this group that the HCCT Steering Committee, which is providing some advice and guidance to the initiative and the national partners, that group has already formed a couple of working groups to focus on developing criteria to identify HCCT initiatives, because we need to have those criteria in place soon so we can identify our initiatives for year 2. And they're also forming a small working group to develop some informational materials to clarify community level work, HCCT initiatives, Module 3 initiatives, because there's been some confusion about the degree to which those are all different or the degree to which they have some common characteristics. So there's definitely more information coming, and we need your feedback in terms of where that information would be most helpful. Before we close today, I want to recognize the teams that are responsible for today's presentation. Here at the partnership, myself and Courtney Kohler, you've heard from today, but you also heard from our colleague Lauren Martin, who's also part of our HCCT team. And also a shout out to Tiffany Marley, who's our VP for Practice Transformation. If you've been involved in the learning communities, you know Tiffany. That's the partnership's HCCT team. And over at NASCSP, Mary Beth and her new colleague Hugh Poole have also been partnering with us to develop this state TNTA plan webinar, as well as to talk about the many other issues that are part of the HCCT initiative and relevant to the network. Mary Beth, any parting thoughts?
I don't think I have anything to add. I know we have a couple of questions in the chat. Do we want to take a few minutes and just run through a couple?
Yes, let's do that. We do have a couple minutes, and I'll see if I can unshare so that I can see them.
Sure. There was a question that I wanted to respond to. Somebody asked, could you suggest some examples of COVID-19 response and recovery that may fit into the definition of an HCCT initiative? Understandably, that perhaps this might be hypothetical at this point. I have heard of a couple of examples of agencies who are working with their community partners to coordinate efforts to respond to COVID-19. So not just, the agency changing the way that it responds to the needs, but really pulling together, assessing the community, bringing together the various players, and then responding to those needs kind of in a very collaborative, coordinated approach. I think that really falls into the idea of HCCT of changing the systems in which that respond to people's needs to serve people holistically. So there's some examples of agencies who perhaps are renting out vacant bank buildings, right, where they are coordinating efforts and resources of various community players to respond to needs. There's just one that comes to mind for me. Erin, I don't know if you have others.
Yeah, I mean, I think we're seeing a lot of others, but I just want to emphasize what Mary Beth said in terms of transformation. And that's another item on the to-do list, to identify a little more clearly what do we mean when we say transformation, because HCCT initiatives would encompass both family level transformation as well as community level change. And in the COVID pandemic, we're seeing all sorts of innovation that is helping families and transformative to them in terms of supporting them and helping them through this crisis. As well as some of the systems change activities that Mary Beth alluded to in terms of community partnerships or new uses of community resources. So we want to continue that conversation, not today, but we do recognize that that defining and clarifying what is transformative and what sort of what is it we're talking about. That's really an urgent matter, and that's why the HCCT steering committee is really jumping in to those topics that I mentioned earlier, trying to think of criteria that help define what an HCCT initiative is, and also helping understand the differences between different types of work, because I know that's been an area of some confusion for some members of the network. I did want to address another comment about, sort of like, is it a problem that the state association and state office, sort of are already doing this and working together? Does the state TNTA plan have to be something different than that? No, that's wonderful. That's if that's already happening, then you have the easiest path possible. because that collaboration is what the state TNTA plan process is all about. So in those states where you're already working sort of hand in glove, state association, state office, talking about the TNTA needs and sharing resources, collaborating, this should be a very easy process for you. For those where that relationship isn't as strong, then reach out to NASCSP, to the partnership, um, and we're available to help try to facilitate that if we can be of assistance. Let's see. Any other questions that we may have missed? I do see that there's a comment about the August date coinciding somewhat closely with state offices having to submit their state plan. So I just want to clarify, and Mary Beth, if my clarification makes things more ambiguous, please stop me.
Okay.
But just to clarify that the state TNTA plan and the state CSPG plan are different things, and they're different in a couple of ways. The CSPG plan is a state office plan, that is developed in partnership with the state network, but is a plan that is routed to OCS for review and approval and agreement. The state TNTA plan is a state association and state office collaboration, and is really just a guidance document. So it's good that the two coincide somewhat in timing because they should speak to each other. But I do want to just encourage everyone, if there's any confusion between the two, please reach out to NASCSP and the partnership, and we can help make sure that those two plans don't get convoluted with one another.
And states have different timelines for their state plans. Some folks by August will have to have already been in routing. Your public comment periods might be over. Some of my point here, though, is that this varies state to state. So be sure that you're having that conversation about timing with your state associations. Be mindful of those other due dates. And coordinate on this front as well. Make the due date work for you, however that looks. With that end date in mind, how's that? I think that's all the questions I saw. Yeah.
And one thing I just want to say, just because I don't want to leave the wrong impression on this, I want to be really clear that while the state CSPG plan will certainly speak to TNTA needs as a component, that is not the same thing as the state TNTA plan. They should speak to each other and be somewhat consistent with each other. But those are different documents, and so I don't want anyone to come away from this thinking, well, we talked with the state about the CSPG plan and they put some TNTA items in there, so that'll just be our state TNTA plan. That is not what the TNTA plan process was meant to be about. We really want it to be a broad sort of ongoing collaboration between the state association and the state office. So again, if there's any confusion about that, just reach out and we'll try to help you out with that. I want to thank everyone for joining us today. We've gone a few minutes over, but I hope this was helpful. We have recorded this. We'll make the slides available. We'll make the recording available. And as I said, within the next couple of weeks, we'll also have the TNTA plan template materials at least available in draft form so that you can have a document in your hand and begin your planning process if you haven't already. So stay safe, community action, and we'll talk to you soon. Thanks, everyone.